Welcome to this BTEC Health Social Care video Unit 2 topic focusing on the regulation of professionals and settings. So when it comes to the monitoring and regulation of a care setting, it can be done internally and externally. So internally is a lot more focus on the staff and how they are working within a setting. Externally, a little bit more focus on the setting as a whole, the place in which care is provided. So internally, when we're focusing on staff can be monitored by line managers who will do monitoring, they'll do appraisals to review the progress of staff members, they'll look at the quality of their work. And this can be done through one-to-one meetings, it could be to do with annual progress updates. So the line manager will take responsibility, and obviously within any organisation there's always a hierarchy, so you're always reporting or being monitored and reviewed by someone slightly more senior to you, at least one position senior to you. You can have observations and shadowing taking place in the setting. So again, that's monitoring your progress, your work, your skills by someone coming in to watch you. There will be reviews on whether you have been engaging with regular training, so that continuing professional development, CPD, have you been doing that regularly? That also ties in with revalidation processes, which take place regularly. And again, you'll be expected to complete certain numbers of hours of training to show that you are up to date with the most recent medical knowledge. Settings may have CCTV, again, to observe and monitor your progress, and they'll be looking at data, so looking at records of treatment, of medications being provided. They'll look at the paperwork and the documents you're submitting when you're doing your work to make sure they are, again, up to date, they're complete, they're accurate. So these could be ways you could be monitored, looking at how a professional, a member of staff, is doing their job and how well they're doing their job. Service user feedback is also really important for getting some insight into how well a member of staff is working, to get some feedback on a member of staff's work. Now, I've put this under internal, but it also does link to external, as you can see here in the box. So, patients can give their feedback through meetings with service users. They can use complaints processes, they can use suggestion boxes, they can have meetings with care managers. They can even go externally to people like the CQC, Ofsted, to raise a concern or provide feedback. And again, that will tie in with external settings. But again, the complaints process will tie in to how we monitor staff by looking at how and the types of feedback they are receiving from their patients. Whistleblowing is also really important, again, for members of staff. So if you as a member of staff were engaging in poor or dangerous practice, then it might be that another member of staff may raise a complaint. If that complaint isn't handled or dealt with, then they may go back or go outside the organisation to people like the CQC, Ofsted, the professional bodies, to raise that complaint. And finally, the last way in which, again, an individual may be regulated, be monitored, be reviewed, could be, in some extreme cases, very rare cases, as a result of some form of criminal investigation. So if they're suspected to have broken the law or engaged in some kind of malpractice, there may be an investigation, which again would be looking at all aspects of their care, a way of monitoring, regulating and checking their care. And I suppose also in terms of regulation is that if staff were to break the rules, then there would be criminal investigations, and that would be a way of keeping their behaviour, their conduct in check. So these are how a professional, a person, may be regulated by within care settings. Now, external agencies that will come in and regulate care generally place more focus on settings. So inspection agencies like the CQC, like Ofsted, who we've mentioned, would be key inspection agencies. And again, their job, the CQC, will come in to look at a setting, and they will determine whether it's safe, effective, caring. They'll speak to patients, they'll look at whether these settings are well led. They'll conduct an inspection by going and doing observations, speaking to line managers, looking at the data, the complaints, the regulations. So they will review the whole setting. and that's what they're going to be focused on. There may be some observations of individual staff members, but generally these agencies are looking at the whole setting rather than an individual. Ofsted, very much the same process. Any services linked to children, generally we generally think of Ofsted as education related, but they also come in children's services, hospitals, care settings, childminders. They look at a whole range of different services, and again, they go in, they do their observations, they do their inspections, they look at the data, they make recommendations for improvements, and they highlight areas that need to be developed. So that's a more focused regulation monitoring of a setting, of a place. As I say, the professionals, the person, are not always regulated in these settings. And then lastly, professional bodies. Now I've put them on the external side because they are external to a care setting. They are the bodies that set the codes of practice, and there are a range of them. So GMC, the NMC, the RCN, HCPC, as I mentioned here, all regulate different professionals, types of professionals in different sectors. But generally, despite their differences, they all kind of have the same sense of ideas of monitoring. So they look at the content, the type of care, the training, the expectations of professionals in those jobs. They will recommend the level of training and updated professional development that has to be taken, and that might even be provided through CPD. They set the standards of practice for everyday work. They set the standards of personal conduct. They set the rules, and again, they will monitor, they will regulate professionals, but these are also based outside of the setting. So externally, mostly focusing on the setting, particularly the inspection agencies, professional bodies, while external, generally more focused on the professionals and setting the expectations of what they should be doing within care. There is a little crossover here. As I say, whistleblowing, criminal investigations, they tend to take place outside of the organisation, but also are linked to monitoring of settings. And just some examples of questions here, the types of question that come up linked to monitoring. It has come up quite a few times, and often it's about how the staff are monitored on a unit, how staff are monitored to ensure someone receives care, how someone could be monitored, like how you can monitor a district nurse. So these would be the types of questions that have come up on monitoring in the past. As always, I hope this has helped clarify a few things. Please like and subscribe, and thank you for watching.